Good morning everyone. I hope you are all doing well. My name is Dr. Amar Kumar De and I am very excited to welcome you to today's online session on a topic that lies at the intersection of biomedical engineering and healthcare. The topic is respiratory function measurement. As an aspiring learner, understanding the intricacies of respiratory function measurement is crucial. Before we dive into the details, let's take some moment to reflect on the significance of this topic. The respiratory system is a vital component of our overall health and well-being. It's responsible for supplying our body with the oxygen it needs while removing the carbon dioxide, a waste product of metabolism. As we explore the world of respiratory function measurement, you will come to realize its pivotal role in diagnosing medical conditions, designing treatment plan, and even enhancing our understanding of human physiology. As we progress through this session, you will gain insights into various techniques and tools used to measure respiratory function accurately. We will also touch on the precautions necessary to ensure reliable data and discuss real-world applications that showcase the impact of this measurement on patient care and medical research. So, without further ado, let's embark on this enlightening journey into the realm of respiratory function measurement. Thank you for being here, and I am truly excited to explore this topic together. Now, let's begin our exploration of respiratory function measurement. Here's the lecture flow for today's session. Let's start with the introduction. The topic of today's session titled Respiratory Function Measurement. In this, we will define respiratory function measurement, its significances in healthcare and medical research, discuss the relevance of studying respiratory function in diagnosing and monitoring various medical conditions. Then we will cover fundamentals of respiratory function measurement. In this, we will explaining the basic anatomy and physiology of the respiratory system, discuss key parameters like tidal volume, vital capacity, respiratory rate and their clinical significances. Then we will move on to types of respiratory function measurement. In this, we will cover different techniques such as spirometry, peak flow measurement, pulmonary function test and capnography. Explains how each technique works and its specific applications in clinical setting. Then together we will cover the precautions for respiratory function measurement. In this, we will discuss the importance of accurate measurement and the potential impacts of errors, highlighting the needs for proper patient preparation and cooperation during these measurements. Talk about factors that could affect measurement such as equipment calibration and patient health conditions. Applications of respiratory function measurements. In this, we explore the diverse range of applications including diagnosis, lung diseases, example asthma, chronic obstructive pulmonary diseases abbreviated as COPD, assessing lungs function before surgery and monitoring respiratory conditions over time. Discuss how data from respiratory function measurement contribute to medical researches and treatment strategy. Finally, we will conclude this session by summarizing the key points covered in the lecture. Now, let us move into the introduction part of the respiratory function measurement. Here we try to define the respiratory function measurements, its significances in healthcare and medical researches. Let's establish a clear understanding of what respiratory function measurement is and why it holds such a significant place in healthcare and medical research. Respiratory function measurement can be defined as the process of quantitative analyzing the various aspects of respiratory system performance. This includes evaluating parameters such as the volume of the air inhaled and exhaled, the rate of breathing, the capacity of the lungs, and the efficiency of gas exchange between lungs and the blood. Now, you might be wondering, why is understanding respiratory function so crucial? Well, the respiratory system is like engine that keeps our bodies supplied with oxygen required for cellular metabolism. It also ensures the removal of carbon dioxide, a waste product of this process. Any disruption in this delicate balance can lead to a range of medical conditions, from relatively mild issue like shortness of breathing to more severe respiratory diseases. Here's where the role of respiratory function measurement becomes paramount. By quantifying these respiratory parameters, healthcare professionals and researchers gain valuable insights into the overall health of patients' lungs and respiratory systems. This information is essential for diagnosing respiratory conditions such as asthma, chronic obstructive pulmonary diseases, abbreviated as COPD, and even lungs infection. Moreover, respiratory function measurement plays a pivotal role in designing personalized treatment plan. For instance, a patient's lung capacity and efficiency of oxygen exchange can determine the type of doses of medication needed. These measurements also guide medical interventions, surgical decisions, and rehabilitation strategy. But the significance doesn't stop there. In the realm of medical research, accurate respiratory function measurement data contributes to our understanding of normal and abnormal lungs physiology. This knowledge aids in the development of new medical technologies, therapies, and interventions. It's also vital for tracking the progress of the disease over time and evaluating the effectiveness of the treatment. As you can see, respiratory function measurement serves a cornerstone in both clinical practice and medical research. By providing us with objective data about how well our respiratory system is functioning, it empowers healthcare professionals to make informed decisions that positively impact patients' outcome. With this foundation understanding in place, we are now ready to explore the fundamentals of how these measurements are taken and various techniques involved. Respiratory function measurements plays a critical role in diagnosing and monitoring a wide range of medical conditions. Let's briefly explore why studying respiratory function is so relevant in the medical field. The first reason is it helps in diagnosis of respiratory disorder. Accurate measurement of respiratory parameters such as lungs capacity, airflow rate, and gas exchange efficiency provide essential information for diagnosing respiratory disorders. Conditions like asthma, chronic obstructive pulmonary diseases, abbreviated as COPD, and different lungs diseases can be identified based on deviation from normal respiratory function value. It's help in early detection and interventions. Monitoring respiratory functions allows for early detections of abnormalities even before the symptoms appear. Early interventions can lead to better management and involved outcome. For example, identifying reduced lung function in children can help addresses potential issues before they become worse. It facilitates assessment of disease severity. Respiratory function measurement help assessing the severity and progression of respiratory condition. This inform guide healthcare provider to tailor the treatment plan and adjust medication based on the level of impairment. It's estimate treatment efficacy. Regular monitoring of respiratory function enable healthcare professional to evaluate the effectiveness of the treatment strategy. For instance, patient with asthma may undergo periodic lungs function test to gauge how well their prescribed medications are controlling their symptoms. It is vital in surgical risk assessment. Preoperative respiratory function assessment is crucial to evaluate patients' suitability for surgery. Lungs function test can identify individual at risk of complications during anesthesia and surgery, guiding medical decisions. It's also helpful in respiratory infections. Monitoring respiratory function is vital in tracking the progression of respiratory infections like pneumonia. Changes in lungs function can indicate the effectiveness of the treatment and the need for adjustment. It's also helpful in long-term disease management. Patients with chronic respiratory conditions require ongoing monitoring to manage their disease effectively. Regular measurement helps healthcare provider to adapt treatment plan to change the required needs. It helps in research and drug development. Respiratory function data gathered from a diverse population aids in medical research. It contributes to understand the underlying mechanism of respiratory diseases and inform the development of new drugs and therapy. It's vital parameter in sports and fitness. In sports medication, respiratory function measurement help optimizing athletic performances. Athletes can benefit from understanding their lungs capacity and efficiency to enhance endurance and overall fitness. It's a cornerstone in occupational healthcare. Certain occupation settings expose worker to respiratory hazards. Monitoring respiratory function can help identifying workplace related lungs issues and implement necessary precautions. In summary, studying respiratory function is essential for diagnosing, monitoring and managing various medical conditions. By providing objective data on lungs health and efficiency, respiratory function measurement empower healthcare professionals to make informed decisions that enhance potential well-being and contribute to medical advancements. The respiratory system is a complex network of organs responsible for exchange of gas between the body and the external environment. It consists of the following key component. First is the nasal cavity and mouth, air entering the respiratory system through the nose or mouth where it is filtered, humidified and warmed. Pharynx. The pharynx is a common pathway for both air and food. It connects the nasal cavity and mouth to the larynx and esophagus. Larynx. The larynx houses the vocal cord and serves as the voice box. It also prevents food and liquid from entering the air path during swelling. Trachea. The trachea or windpipe is a tube that carries air from the larynx to lungs. It reinforced with the cartilage ring to keep it open. Bronchial tree. The trachea branches into small tubes like bronchi, which further divides into the bronchioles. The structure carry air deep into the lungs. Alveoli. At the end of bronchioles, tiny air sacs called alveoli facilitates the exchange of oxygen and carbon dioxide with the bloodstream. So, this is the basic anatomy and physiology of respiratory system. Now, let's delve into some essential respiratory parameters and their clinical significances. The key respiratory parameters and the clinical significances are as follows. The first important parameter is tidal volume, abbreviated as TV. Tidal volume refers to the amount of air that moves in and out of the lungs during normal breathing. It is typically around 500 milliliters. Clinically, tidal volume is used to assess lungs function and can altered in conditions like restrictive lungs diseases. Vital capacity, abbreviated as VC, is another important parameter. Vital capacity is the maximum volume of air a person can exhale forcefully after a maximum inhalation. It includes tidal volume, inspiratory reserve volume and expiratory reserve volume. A reduced vital capacity may indicate lungs diseases or restriction in lungs expansion. The next parameter is the respiratory rate, abbreviated as RR. Respiratory rate is the number of breaths taken per minute. Normal adult respiratory rate ranges from 12 to 20 breaths per minute. Abnormal respiratory rate can indicate various health issues such as respiratory disorders or metabolic disorders. The next parameter is the forced expiratory volume in 1 second, abbreviated as FEV1, is another important parameter. It measures the volume of air forcefully exhaled in the first second during a forced breathing. It's used to diagnose and monitor obstructive lungs diseases like asthma and COPDs. Reduced FEV1 indicate airflow obstruction. Reduced FEV1 indicates airflow obstruction. The next parameter to be discussed is peak expiratory flow, abbreviated as PEF. It is the maximum speed of air exhaled during forced breathing. It often used to monitor asthma and assessing the severity of airway narrowing. The functional residual capacity, it is an important parameter, abbreviated as FRC. It is the volume of the air in the lungs after normal exhalation. It plays a role in maintaining lungs function and preventing lungs collapse. A widely used parameter is the oxygen saturation, abbreviated as SpO2. Oxygen saturation measures the percentage of hemoglobin molecules carrying oxygen in the bloodstream. It's a vital parameter to assess how well the lungs is oxygenated by the blood. The another important parameter that we have today is the carbon dioxide level. The partial pressure of carbon dioxide in the blood reflects the efficiency of carbon dioxide removal by the lungs. Abnormal levels can indicate respiratory disorder. Understanding these parameters helps clinical diagnosing the lungs condition, design treatment plan and track disease progressions. These measurements are also crucial in pre-operative assessment, emergency medicines and crucial care setting. In our journey through the respiratory function measurement, these fundamental parameters provide a valuable insights into the lungs health and guide healthcare decisions. Now let us talk about the types of the respiratory function measurement. The field of respiratory function measurement offers a variety of techniques to assess lungs health and function. Let's explore some of this technique by looking into how it works and their applications in clinical setting. The first and widely used technique to measure respiratory function is the spirometry. Spirometry is one of the most commonly and widely used respiratory function tests. During spirometry, a person breathes into a device called spirometer, which measure the volume of air exhaled and the rate at which it exhaled. The applications are spirometry is used in diagnosing and monitoring conditions such as asthma, COPD and restrictive lung diseases. It helps assessing the lungs function parameters like forced vital capacity FVC, forced expiratory volume in 1 second FEV1 and peak expiratory flow PEF. The second technique we have in our list today is the peak flow measurement. Peak flow measurement involves exhaling and forcefully and quickly as possible into a peak flow meter. The meter provides a value indicates the maximum flow rate achieved during exhalation. The applications are peak flow measurement is especially relevant for asthma management. It helps patient monitor their airway obstacles and adjust medications doses accordingly. The third technique we have in our list today is the pulmonary function test PFT. PFT comprises of a range of tests that assess various aspects of lungs function. These tests include measurement of lungs volume, capacity and gas exchange. The applications are, it provide comprehensive insights into the lungs health. They are used to diagnose a wide range of respiratory disorder, evaluate the effect of lungs disease and monitor treatment progress. The fourth technique is the capnography. Capnography measures the concentration of carbon dioxide in exhale breath. It involves using a capnograph which display the concentration of CO2 over time. The applications are, capnography is used in various settings including anesthesia and critical care. It helps monitor a patient ventilatory status, assess the effectiveness of CRP and detect condition like hypoventilations and airway obstruction. The fifth technique is the pulse oximeter. Pulse oximeter measures the oxygen saturation of arterial blood. A sensor is usually placed on a finger or other part of the body. The applications are, pulse oximeter is a quick and reliable way to monitor the oxygen level in patient. It's widely used in hospital, clinics and home setting to assess oxygenation status and guide treatment decision. The sixth technique is the non-invasive ventilation monitoring. This involves monitoring a patient respiratory parameters during non-invasive ventilations. Sensors can track respiratory rate, tidal volume and other relevant matrices. The applications are, it ensures patient receives adequate support. It's commonly used in patients with sleep apnea, respiratory failure and other types of lungs diseases. Finally, we have impulse oscillometry. Impulse oscillometry measures airway resistance and reactance by assessing the pressure and flow change during quiet breathing. The applications are, it's particularly useful for assessing airway functions in individuals who may have difficulty with traditional spirometry, such as young children or patients with severe lungs diseases. These techniques offer a valuable insights into lungs function. By providing objective data, they aid healthcare professionals in diagnosing, monitoring and managing respiratory conditions effectively. Remember that the choice of the technique depends on the specific clinical scenario and the information need to guide patient care. Now, let us talk about the precautions that to be taken care for accurate respiratory function measurement. When conducting respiratory function measurement, it is crucial to take specific precautions to ensure accurate and reliable results. Here are some important precautions to consider. The first one is the patient preparation and cooperation. It can be achieved by explaining the procedure to the patient and ensuring that they understand how to perform the test correctly. Advise patient to avoid heavy meal, smoking and rigorous exercise before test. Ensure the patient is comfortable and easy before starting the measurement. The second precaution to be considered is the proper equipment handling. It can be accomplished by regularly calibrate measurement devices to maintain accuracy and consistency. Use high quality, well maintained equipment to ensure reliable measurement. The third one is achieved by following standardized techniques. In this, follow the standardized technique and procedure for each measurement to ensure consistency across tests. Ensure the patient is in a standardized position, example sitting or standing upright during the measurement. The fourth precaution to be considered is elimination of confounding factor. Conduct measurement when the patients are at rest to avoid the influences of recent physical activity. Be aware of any medications the patient is taking that might affect the lungs function and consider their impact on the result. The next factor is the environment control, which plays an important role while measurement. It can be achieved by maintaining a comfortable testing environment with stable temperature and humidity level. Minimize exposure to irritant such as strong odor, smoke or allergies during measurement. So, these are some of the very important factors that need to be taken care as a precaution while conducting these measurements. Now, let us talk of the diverse applications of respiratory function measurements. The first application is for diagnosing lungs diseases. Respiratory function measurement help diagnosing asthma by assessing parameters like forced expiratory volume and peak expiratory flow. These measurements track airway obstacles and guide treatment strategies. It is also helpful in diagnosing chronic obstructive pulmonary diseases. Accurate measurement of FEV1 and forced vital capacity ratio are essential in diagnosing and classifying COPD's severities. It is also helpful in assessing the lungs function before surgery. Preoperative evaluations. It finds application in monitoring respiratory conditions over time. The fourth application is in evaluating fitness of physical activities in sports and exercise physiology. Next, pediatric care is an important area of application. Childhood respiratory disorders. This application highlights the versatility of respiratory function measurement techniques across variable medical fields. In our exploration of respiratory function measurement, we have covered a wide range of topics that understands its critical role in healthcare, medical research and patient well-being. Let's summarize the key points discussed. First, we have discussed the type of respiratory function measurements, then the precautions for accurate measurements, then the applications of the respiratory function measurements. In conclusion, respiratory function measurements stands a cornerstone in modern healthcare. It's combined with accurate measurement empowers healthcare professionals to make informed decision, improved patient outcome and contribute to medical advancement. This ability to diagnose, monitor and manage respiratory conditions relies on their technique, demonstrating their invaluable role in enhancing the quality of life for individuals worldwide. Dear all enthusiastic learner, it is with a sense of gratitude and satisfaction that we conclude our online sessions on respiratory function measurement. We delve into a comprehensive journey exploring the fundamental aspects, measuring technique, precautions and applications of this vital field in healthcare and medical research. I would like to express my heartfelt appreciations to each of you who have joined us today. It's inspiring to see your enthusiasm and dedications you bring to pursuit of knowledge and understanding the realm of respiratory function measurement. To our participants, I encourage you to carry forward the knowledge gained today into your academic pursuit and professional endeavors. The world of respiratory function measurement is ever evolving and your engagement with the subjects holds the potential to make significant impact on the living of the patient and advancement of medical science. Thank you once again for your presence, your attention and your decision to the pursuit of excellence. May we continue to explore, learn and contribute to the betterment of healthcare and well-being of individuals. Wishing you all success in your future endeavors. Thank you and have a wonderful day.